So I think we can start now. We have a good group already here. Please, if you have, as I go along, as I talk about the different topics and move between the different things, I will allow some time for questions and whatnot. But please just put your questions in the Q&A as we go along, and I'll stop before the end of every topic to answer those, so we can kind of keep it in the flow. Don't leave it till the end. I'm sure we'll have a lot of questions at the end as well. As we know, female hormones, it's a huge topic, and we're gonna delve right into how do we formulate best for women's health when we use the Vitamin Lab tool. Okay. So just a quick little review of where we're at and where we're going with it. Where do we start? Identifying the symptoms and the hormones that are impacted. And so to kind of give you an idea of what are we talking about when we talk about, whether it's a progesterone or an estrogen dominant issue here, what are we dealing with? The next thing we'll talk about, which is really close and dear to my heart, is the detox phase. I'm a big believer in that, and we'll delve into how do we formulate for that properly. The next thing we'll talk about is adaptogens, their job with women's health generally, but also more specifically when we talk about the women's health and how do we regulate hormones. Adaptogens play a big role there. The endocrine function assessment, so when we look at the whole system and not just the estrogen, progesterone, and how do we accommodate that in our formula. Protocols that we recommend to identifying the symptoms and the hormones that are impacted, so kind of how are we matching which protocol to which situations. And then I'll talk a little bit at the end of splitting the formulas for AM and PM. As we know, women's health a lot of time can impact both. They have both issues both during the day and during the night, and sometimes in those situations, or if it's a really big formula, we want to split it into an AM and a PM formula. Okay, so delving right in. So where do we start? Do you know that woman who comes into your clinic, she's in her early 40s or late 40s, and she has all the symptoms? She's feeling stressed during the day, and her moodiness, she can't sleep at night. Sometimes it comes with hot flashes, but sometimes it doesn't. And her hair is thinning, her skin is now reacting to everything and anything. We can see impact literally in every system in her body. Her immune system is down, her joints are achy, all of these things. Where do we start when we have that kind of patient? And so that's kind of what we're here to try to kind of formulate for. Vitamin Lab has many ingredients and protocols to support women's health. So I really like to use, and you'll see it here today, I like to use the protocols as kind of a template to where do I start to formulate from. So I would sometimes add a protocol and then kind of edit the different ingredients in it, or edit it to some extent, but it kind of gives me a hold of where do I start to think when I'm thinking about that specific issue. Okay. So first of all, we'll start with just a quick review of kind of when we talk about estrogen and progesterone are two dominant ones, of course, along with all the others, but these are the ones that we see changes significantly throughout women's life and kind of how they impact women. And sometimes when we really know the difference well, that would help us to distinguish whether we need to really address progesterone here. Are we dealing with estrogen dominance? Most of the time we'll address more than just one or the other, but where our focus will go has to do with kind of which is the main one. So with estrogen, low estrogen will look more like a dry skin, dry eyes. That's a big thing, especially in perimenopause. Weak or brittle bones. So the women who come to you after they've done the assessment, the bone structure assessments, that would be definitely estrogen. Trouble concentrating, short-term memory problems, hot flashes, night sweats, irregular periods or no periods at all tend to be more of an estrogenic issue. It doesn't allow the LH, the FSH to do their job properly, and so we'll see an amenorrhea. Headaches before or during your period tends to be more estrogen related, whereas if you'll see them here, headaches before and during ovulations tend to be more progesterone related. So that also gives us a little bit of a hint to which of the main ones are we dealing with here. Vaginal dryness, recurrent UTIs is very much an estrogen issue. Joint and muscle pain also tend to be more estrogenic than progesterone. Signs of both, which are of course very common: moodiness, irritability, weight gain, especially around the belly, when we'll talk more about that later on. Decreased sex drive and painful intercourse can be either a progesterone or an estrogen issue. And fatigue and trouble sleeping are, of course, common with both. And then things that are more about progesterone than estrogen would have to do, for example, hair tends to be a bit more progesterone correlated versus estrogen. And so if they complain on a significant hair loss, progesterone is the thing that should pop to mind. Fluid retention and bloating tends to be more progesterone than estrogen. Light spotting before menstruation means that it's a low progesterone. The progesterone is not high enough to hold the uterine lining properly. Headaches, as mentioned with the headaches, so headaches around ovulations tend to be more progesterone related versus headaches around PMS or around their periods. Fibroid and endometriosis are very much progesterone related, as well as tender breasts. Gallbladder problem and adult acne as well tend to be more progesterone related versus estrogen. So if you see some blood work that is off in terms of, the gallbladder function, liver enzymes are high, these kind of things, and there are maybe a few other symptoms, progesterone is the thing that should pop in your head in that sense. So that's just to give you kind of an overall picture of what are we talking about when we talk about low progesterone versus low estrogen. And some things, of course, would be just the general low hormones, and it would be hard to differentiate. Okay. So estrogen detox. Honestly, as a practitioner, as somebody dealing with a lot of women in my clinic, I do almost everybody will get an estrogen detox when they come to see me first. A lot of time, whether it's an estrogen dominance on its own or whether it's low progesterone, and I'm suspecting it might have to do with estrogen dominance, I'll start them off on a 90-day estrogen detox, and I'll include a few other ingredients in it, but that tends to be a very big go-to for me. I find really good results even with just that protocol on its own. A lot of time, after a month and a half, we'll see a significant difference just by doing the estrogen detox. And so when the situations where it really needs to come into mind is when women are stopping contraceptives. So whether it's they're trying to get pregnant, whether they decided the contraceptives are not their thing, it causes a situation called pseudo PCOS. So basically, just because of that initiating hormonal changes, it causes a surge of estrogens that can go wild in the body, and sometimes our body will store them in the fat tissue, especially the visceral fat, and so we'll see basically an estrogen dominance situation after women stop contraceptives. That usually will come quite a few months after, but that's when we'll see that. Balancing HRTs. So usually I wouldn't give this formula for somebody who's on HRT if she's in a good place with that. But as we know, HRTs are really hard to balance. Sometimes they're almost at a little bit of an over, and we want to help their body to clear out a bit more of those HRT as we drop the dosage. That's when this one does come into play and would really help. Every woman living in the modern world, so as we are exposed to car exhaust and to herbicides and pesticides and to food and plastics and all the things, there are a lot of xenoestrogens out there that tend to go into our bodies, and our body have a hard time clearing those out. And so our body tends to store those in the visceral fat or in the belly fat. And so a lot of times when women would complain about belly fat, even if they're doing, you know, all the workouts and the intermittent fasting and everything, belly fat won't go away. Or in just general, these situations, doing this protocol once a year is kind of a great detox, a great like habit. I recommend that to a lot of my patients. I personally do it as well. Every spring, I'll do a 3 months round of a detox like that. PCOS, of course, this is an estrogen dominance situation there. And then, so this is the estrogen detox protocol that I've created for myself in our Vitamin Lab portal. And then I just tend to reuse this one again and again. So DIM, in order to help to basically connect to those xenoestrogens, pull them out of the fat cells and into the bloodstream. It also helped to neutralize them a little bit. Then the calcium D-glucaride to really support that phase 2 detoxification in the liver and help to clear out that excess estrogen. I add milk thistle to support the liver cells as they do their job. So between we're asking a lot of the liver. So between that one and the calcium D-glucaride pushing for stronger detox, I add the milk thistle as part of it. Chestberry extract, so Vitex at 0.5. I like this one because there's a lot of feedback mechanism between the estrogen and progesterone. And with Vitex promoting progesterone, it helps to clear out or to decrease the side effect of those xenoestrogens or all of that estrogenic effect. And then the broccoli powder, again, just for the sulforaphane in there to support with the DIM and to give it kind of a whole food aspect with that active component that is the DIM in here. So that tends to be my protocol, and I use it quite often with my patients. If there are any questions about that or anything like that, please drop it here in the chat. Okay. So adaptogens. So once I put the started them with the detox, I will top it up with adaptogens. We have quite a big, nice like variety of adaptogens. I only put a few here to kind of show you guys, or these tend to be my favorite. Ashwagandha is my top favorite adaptogen. It's a very much kind of a woman's friend. Most women respond incredibly well to ashwagandha. I love using that. It's a good one to balance both the hypothalamus, the pituitary, the adrenals. It's like you get, a 360 support in one herb, which is, I find that amazing. Another few favorites of mine. So rhodiola is a great one because it helps with moodiness. Now, rhodiola, the nice thing about it is that in low dose, it lifts your mood up. It's more for depressive symptoms, whereas higher doses of rhodiola would help with reducing anxiousness and anxiety and these kind of things. So it really is a very good modulator for mood. And I actually use that one in this formula, and I would usually go lower dose. And I would sometimes tell my patients that if they have like an anxiousness kind of day, to take more that day specifically. So I increase the dosage by increasing how many capsules they're getting from you as a daily dose as needed. So you can kind of play with it as you would with a volume, to turn up the volume or turn down the volume with that. Siberian ginseng is a really good one for energy, of course, and for like more of an uplifting, get up and go kind of thing. A lot of my patients who are like having a hard time in the mornings and having a hard time starting the day, or maybe after bad nights and stuff like that. But even if they had a good night, they have a hard time kind of starting up in the morning. They'll get Siberian ginseng for me. Hawthorn is really one of those underrated one, I find. It's a fantastic herb that has to do with anything that has to do with like the heart. So heart palpitations, even like hot flashes, or people get this like flush. It's not necessarily even a hot flush, but this kind of like almost a rosacea situation, like a flushing kind of a situation. It's a really nice one for that. It's good for anxiousness. So really one that relates specifically for women, tends to be more with later in the let's say perimenopause, but maybe in the later years, so late 40s, early 50s, late 50s. That's where hawthorn a lot of time plays a role. Fantastic, gentle herb in that sense. Holy basil, the focus here is it's a gentle calmative. It helps to promote A waves, the alpha waves in the brain, so more of a calming wave, similar to L-theanine a little bit. It's a really nice one for the more anxiety-prone patients, for sure. Maca, again, for energy and stamina. So maca is one of those herbs that work incredibly well if you have patients who are also athletes or just work out a lot and are trying to increase stamina. So maca would support them in quite a few different ways, which is fantastic. So both with the stamina, but also with general energy, with focus, a really great herb. Dong Quai is or what is known here as female ginseng, does have more to do with estrogen, more so than other herbs. So the same way that with trying to clear out excess estrogens, we'd use chestberry extract. Here, Dong Quai plays a big role when you're trying to increase estrogen. So when you see things like dry skin, dry vaginal issues, dry just bones, if you want to increase bone density, these kind of things, that's where you would really want to include Dong Quai versus other adaptogens. That's where this one would really shine. Ashwagandha, as mentioned, and then astragalus. Astragalus is a bit of an underrated adaptogen. It is an adaptogen. It does work on reducing cortisol and modulating the whole adrenal effect. But the other thing that it does really well is that it supports immune system. So this is one that I tend to use more in the winter. A lot of time I'll just add it in for a formula, for a patient who's coming again, and I would just, for their winter formula, I'll throw in some more vitamin D, I'll throw in some astragalus. So women who are more prone to getting every cold and flu that walks around them, women who work in situations where they are much more exposed to bacteria and viruses, so your teachers, your doctors, these kind of things, a really good herb to kind of keep in mind for that. We have a really nice protocol to select. It's called the Adrenal Adapt protocol. It has some vitamin C and some B5, more specifically because when cortisol levels are high, these vitamins will go down and will create a deficiency. So this is not, it won't replenish vitamin C if somebody really needs to increase significantly the amount of their vitamin C. It does give you a little bit of a boost, but basically in very stressful times, it will bring you to balance and bring you to like a really nice kind of a balanced amount of your vitamin C. So it would prevent the deficiency. Same with the B5, we use the calcium panthenate, which is a really good one to use. It has the rhodiola here, as you can see, 150. It's a pretty moderate dosage. For things like anxiety, I would go up to 300 usually, but for like a general support, for a more of like a blue kind of day support or depressive symptoms, rhodiola at 150 is a really good dosage. Siberian ginseng here, and then my absolute favorite are ashwagandha, that works in a fairly low dose, so 125 is a great dose for ashwagandha, and there's really no need to add more. Any questions so far before we move on? Perfect. Oh, you guys are great. Okay. So as mentioned, after we talked about the detox and we talked about the adaptogens, the next thing that we want to assess and to kind of see is what other players in the endocrine system are not balanced here and can contribute to that. So one of the reasons I love hormones and the endocrine system is because of, you can kind of create one effect in one area of them, and it will have an effect on all the different glands of the endocrine system. So you can you can intervene with the thyroid, and you will see improvement in sleep, or in stress response, or with the regularity of your periods. You can intervene with the estrogens, and you'll see improvement with thyroid function, these kind of things. So I love that. I love how complex and how kind of how weaved together these things are in the endocrine system. I find that fascinating. I really when we talk about women, it really is something big to consider. So the T4 and T3, as we know, regulate our body's metabolism. Oh my goodness, and impacting how we process estrogen. So going back to an estrogen detox, so going back to women who tend to present with basically estrogen dominance, keeping the thyroid in mind and addressing thyroid issues can be very, very useful with these patients. You'll see a really big impact with a fairly low amount of intervention, which is always fantastic to see. Thyroid dysfunction can lead to imbalances in hormones like prolactin, which would then throws off the whole ovulation system. So we'll see irregular periods, we'll see infertility, we'll see all the different things. It will decrease both estrogen and progesterone, and so the prolactin is a player that we really need to be mindful of to make sure we kind of calm it down, and we can do that through the thyroid, which is quite lovely. And then as we know that so many studies about this one, right? Subclinical thyroid dysfunction. It's very common in perimenopause and menopause. And the other situation where it is very common is for women experiencing infertility. And so sometimes, even if they do fall, their blood work is within range, the reality is that it's quite hard for them to get pregnant, and it's a subclinical one. So one of the ones that I like to start with, and honestly, I barely even touch that protocol. I usually use it as is our thyroid support. It has the selenium that you would need. It has the zinc. So L-tyrosine, so really things to kind of support that conversion to the T3, T4, as well as the ashwagandha. And then D3, this is a minimal amount of D3. Sometimes that's something worth increasing, depending on the patients, depending on blood work, of course. But that's one of the things that I would a lot of time change in this protocol, depending on my patient. So that's about for thyroid. Pretty clear cut. I know it's a very common knowledge here, but it is something to take into consideration when you're looking at patients either with issues getting pregnant or in perimenopause year. It's really important to address thyroid. Okay. Our next one, our HPA, of course, such a big chop of the HPA with women's hormone, of course. It regulates our stress response, significantly impacted during peri and menopause due to the hormones fluctuations. It can lead to such a huge range of symptoms. It can manifest as this is a very common one I find with my patients, is that it manifests as increased stress sensitivity. So it's not necessarily that their day-to-day stress has gone up as much as their ability to handle stress has gone down. And so that's where addressing that and adaptogens would really, really support women around these ages. So the stress sensitivity, of course, as we know, anxiousness, depression, insomnia is huge with that. And we'll talk a bit more about that specifically close to the end of this presentation. But insomnia is, of course, huge. Many symptoms when are overlapping with what are known as perimenopause symptoms, and for good reason. So for example, the declining progesterone can destabilize this axis by increasing the sensitivity to stress, whereas like estrogen can amplify the HPA axis reactivity to stress. So depending on where you fall within what your other hormones are doing, what your progesterone is doing, or what your estrogen is doing, you can really really experience that increased sensitivity to stress, or all of a sudden being much more reactive than how you usually know yourself, which is a big thing. And so this one is a big thing to address. And we'll talk a little bit about how. So some of my favorite herbs for this, and this tends to be one of my go-tos, is phosphatidylserine. I give it to a lot of my patients. It really helps to normalize the stress response in the HPA. So it helps to normalize it in a few ways. Particularly, it works phenomenally for people who the cortisol tends to impact their brain a lot. So phosphatidylserine crosses the BBB. It is able to kind of block those receptor sites and not allow cortisol to connect. And so it really helps to decrease the amount of stress response, or the cortisol response within the brain. So, Lisa asked about boron for thyroid. Yeah, absolutely. It's definitely something you can use and you can add. I tend to do an assessment of boron from food sources. It's pretty easy to get it from food, and you need a fairly low dose. So that's why this is one of the ones that I would tend to give basically through some simple food recommendations. But if you assess that your patient is not there and is not getting enough, or you want to kind of make sure, then absolutely add a 10 milligrams. No harm done there, for sure. All right. And so moving on to the ashwagandha, as mentioned a few times, I think, I pulled out some recent data because so many studies have been done on ashwagandha and adrenal health. One good meta-analysis that was published in November 2023 showed that the ashwagandha decreased cortisol level and increased the LH and the FSH, which resulted in stress level reduction and improvement in fertility. So again, shining star for infertility, for perimenopause, all of these guys where we're trying to kind of balance all the different hormones within the system. That ashwagandha really shines with that. Other studies show that withanoid can increase the secretion of the T3 and T4 from thyroid, as mentioned, and so that could also really support both the adrenals, as well as and the pituitary and the LH, FSH, as well as the thyroid and the parathyroid. So a really nice herb for women all around. Black cohosh is another really interesting one. The mechanism of how it works isn't actually completely understood. We don't know exactly the pharmacokinetics of this herb, which is quite fascinating to see. So yeah, maybe if we'll do this webinar in a couple of years, we'll have more new information about that one. It does have an established clinical impact, both on estrogen and LH levels. But yeah, as mentioned, we're not sure how it does that, but it would help to increase both of those. And so it does help when we basically see a lower estrogen levels, whether it's in infertility or in like later menopausal years sometimes. Okay, so wild yam is my last little buddy here. Again, a really nice one for estrogen. This one works on estrogen as well as DHEA, which I know we sometimes will give DHEA on its own. I do that as well. But it does help. But if we want to either not give, a direct hormonal intervention, or want to try something else before we go with DHEA, wild yam is the one to think about. The dioxin effect on the HBR there are quite a few ways of how it works on that. It's observed to reduce the activity of the HPA axis in stressful situations. So specifically in my studies, they actually checked for cortisol and norepinephrine, and the dioxin actually brought that down. It may help to normalize the stress response by reducing the HPA axis hyperactivity. So again, if we talk about that perimenopause situation where not much in your life has changed, but you feel that it's all of a sudden so much more stressful than what you're used to, that's where wild yam could really play a role and reduce that hyperactivity. Yes, and of course, because of it reduces that hyperactivity, it would help to alleviate psychological and behavioral changes that are associated with stress and depression. That's what the studies say about this lovely herb. Okay, so a few more questions here. If a patient had a thyroidectomy, how does this change this axis? Oh, that's a fantastic question. Would a client require more or less of the HPA herbs? So somebody on Synthroid. Okay, so with Synthroid, yeah, it would. They would basically require higher amount of the support, the support from all around, basically, right? So if we're giving them Synthroid, sometimes with depending on exactly what was the thyroidectomy, that what exactly they cut out, but sometimes we will of course add T3, T4, and so to help balance those or to keep those in check, it's hard to it's a balancing act. It's a continuous balancing act depending on what's going on in her life, depending on what she's what stress level she's under at that over those few months. And so supporting with HPA herbs is really, really beneficial here. You'll see a really good response with that. It does help your body to kind of balance, even though there isn't an actual thyroid, it does help to balance the symptoms around it. So symptomatically, you'll get a happier patient for sure. Speaking on any contraindications for ashwagandha. Okay, yeah, sure. So we can touch a bit about that in the end with ashwagandha. There are some situations with contraindications, not a lot, mind you, but specifically with medications for anxiety. So those ones that we know well, some of the patients, if they're already on some high dose anxiety meds, that's where you want to be very careful with ashwagandha. Either avoid it completely, or if it's a low dose and they are taking it during the day, then you can give low dose ashwagandha in the evening to support sleep. So with the half-life of the medication and the half-life of the herb, you're not running a risk of the of serotonin syndrome, but it does need to be properly separated. So I wouldn't overlap that. So this would be a good situation where an AM/PM formula will come into play, and we'll definitely talk more about that. Okay. All right. So just a few of the protocols that I tend to like, that tend to be my go-to with these kind of patients, and then I do tend to edit them more. So we've mentioned the adrenal adapt before. This one is now, if we look at it through the HPA glands, the rhodiola, the Siberian, and the ashwagandha would support more than just the adrenals themselves, and so that would be one of those things to think about. Inflammation support is a big one for when we see with perimenopause and menopause, as well as when we see a lot of issues that tend to be like inflammatory throughout the body. So that tends to be definitely a go-to with that. It will impact thyroid significantly. It would impact some issues with the pituitary. I don't know if you guys came across it. I have quite a few patients that suffer from Sheehan's syndrome. Sheehan's is basically an autoimmune disorder that attacks the pituitary, and so it shuts down all the hormones in the body. Inflammation support and reducing inflammation does a whole lot of good in those situations. So definitely something to keep in mind. Of course, it would support other symptoms for that patient. So definitely if they have joint issues or any kind of other inflammatory issues, skin inflammatory issues, right? So when we're talking about our rosacea patients, or patients with like inflammatory bowel issues, all of these things, definitely something to keep in mind. Very, very common in the perimenopause and menopausal years. And then the antioxidant blend as well. So this one it helps with, it's like a supporting act to those adaptogens, adaptogenic herbs, as well as all the endocrine system, specifically the HPA, because of the significant increased need for antioxidants. So, as we know, cortisol is high, norepinephrine is high, the oxidative stress goes up the roof, and so oh my goodness, an antioxidant blend is a really fantastic one to take into consideration and to utilize as support. Okay. All right, so we've talked a little bit about the detoxifying the excess estrogens, and we moved to the adaptogens, and we talked about the other glands in our in the HPA and how we kind of think of supporting them when we support our patient. The last thing to assess is the nutritional deficiencies. So as we know, right, many women around these ages, iron, B complex, CalMag, fat-soluble vitamins tend to be a really big issues with them. And so I love Vitamin Lab with being able to just throw those in with the other support that I'm giving them, instead of giving them a whole other supplement that is separate from that to support. And so it really kind of puts it all together. So we have a nice bone health one. As we know, bone health is one of those things that, like, every Monday, basically, there's a new study on a new mineral or a new nutraceutical that is needed for bone health. So this is a fairly basic bone health support, but you can definitely increase that, add whatever other ingredients that you find important and crucial for bone support. I will tell you that up to last year, to up to the studies that were published in 2024, they are talking about lower doses of calcium for bone support. We know that high dosage can cause arterial calcifications, and we really want to avoid that. And so the max safe amount in studies that I found talked about 350 milligrams per day. And I do like to go a bit lower than that. I would recommend calcium through diet support, but then as supplement, I wouldn't go much higher than 200 milligrams. Of course, up to you and how you do that, but then make sure you balance it with about 50%, so a 2-to-1 ratio with magnesium. Vitamin K2 is crucial. Of course, vitamin D. I personally like to add all the fat-soluble vitamins all together, so I would add some vitamin A and low-dose vitamin E with that. So there's a question about the B vitamins, whether they're methylated, and for those with MTHFR, of course, and genes. Yes, so we have there we go. So the B complex here, as you can see, they're all methylated, and we also have the hydroxycobalamin for the COMT gene variation. And so if you know that your patients have that, and then switch that out, take out the methylcobalamin and switch it for the hydro one for sure. Yeah, and so it's interesting. So the comment is that it seems that many of the menopausal women have that. It's true, Michelle. I find the same. I don't actually know if it's but it feels like it more comes into it's more evident in those years. So not only that now they are getting tested and whatnot, but also that it's like during that year they all of a sudden get more of those symptoms of these gene variations. It is very common. I completely agree. It will be fascinating to follow in the next few years and see what new studies come about that and that specific correlation, because it is for sure there. I 100% agree with you. And so, yeah, as you can see, we do have the methylated ones, and you can kind of play with that. I found that I had to do a deep dive into one of my patients when they had a really severe, basically methylation symptoms. After I already gave them like methylated Bs, and they were low, and so they had like this sweet period of time when it was phenomenal, and then they had the symptoms come back again. And after a deep dive, I found that with methylated B, you can get too high even for people with that gene variations, and so I tend to not go much higher up than these dosages, to be honest with you, especially if I don't want them to get into like a detox reactions. And so I keep it low and slow. So even though they had this, gene variation their whole life, but now they're doing, now we're trying to kind of keep them more balanced, but I don't want them to get into hypermethylation. And so I basically will keep them on lower dosages, as well as the, like after a while when they're balanced, I will cycle those B vitamins in and out. So I will tell them to, like, let's say whatever their supplement is, like take a break over the weekend. So do 5 days on, 2 days off, or these kind of things, because of course there is the genetic issue, but you are donating a lot more methyl groups than what their body is used to using, basically, right? So you are running the risk of having too much, which is quite interesting. More evident in menopause because they're all stressed out. Interesting, Michelle. Very, very. We can talk more about that for sure. Okay, so when and how to use the AM PM formulas. I love doing those. We'll do a little experiment. So let me share my. Oh, I'll have to do it this way. There we go. So I'm gonna share with you my my portal. There it is. And there we go. Okay. You guys seeing that all right? I hope so. Okay. So let's say I am my patient. And so I'm going to create a formula for myself. I'm in my early 40s. I start with my estrogen detox that I love so much, and I do it for myself as well. I live in Canada, so vitamin D is definitely always a concern. So I would add for myself usually around 75. And let's say I am in my perimenopause years, which I am, and I do have issues with sleep, and so I would add some things to kind of help my body state. So I will add the phosphatidylserine. Oh, come on. Always great that things get. Oh, that's what I missed. There it is. Okay, so my phosphatidylserine, I like it at 300 milligrams. I think that's a good amount. I'll add here my ashwagandha for sleep. There we go. I'll add a bit more of the L-theanine. Let's do theanine. 250 is a good one for sleep. GABA is a nice one I like. Maybe just 150. And let's say that as a perimenopausal woman, I have issues with my hair. My hair is falling, and I want to make sure that I support that. So I would add this formula right here, this protocol, the hair health. So we'll add this one here. And for like just a general stress support, I will add the antioxidant blend. So this is quite a lot. And this will come up to 8 capsules. So I'm thinking, so I'm going with my patient and saying, you know what, with 8 capsules, let's give you some support for during the day as well, and we'll split it into an AM and a PM formula. And so the way that I would kind of go that, I will basically, this is how I can do it. You guys can do it in however way you want, but I would add everything that I want to give to this patient. So if I want to give her the adaptogens for the morning, so for energy and for and to kind of start the day better. So it will be this one here. I'll edit it to reduce. Let's reduce it to 100. I already have ashwagandha, so I'll take this one out. There we go. But vitamin C, B5 for sure. Let's say, there's some iron issues, which is so common in that sense. So let's do the iron deficiency add-on right here. So I get some iron and some folate, B12 as methylcobalamin, and some more vitamin C. And so I have 900 milligrams of vitamin C, which I'm actually okay with for as a general support. There we go. So this is everything and anything that I want to give this patient. However, it's quite a lot. So what I'll do is I'll change this one, the name, and I'll call that Hagar AM. And then I'll do copy. There we go. And so this copied formula, I will change that into a PM. Now, what I'm basically going to do is I'll edit out everything that I don't want in the PM formula. So I like to do estrogen detox in the evening, so I'm going to leave it as is. The chestberry extract will help support sleep as well, right? I will take out the adrenal adapt because that is definitely more of a morning thing. Antioxidants, I would also prefer that one in the morning, so I'll do that. I'll remove that one. The hair support. So this is actually a really nice hair support and to build the hair support, and it is more for during the night. I also get some resveratrol and turmeric here, so a bit more of a support that way, which is lovely. Some collagen, I like that at night. And then iron, I don't want it at night, I want it in the morning, so I'll take this one out. Just delete. Ashwagandha, I have here at 125, so I'll remove this ashwagandha as well. But I do want to keep the vitamin D, the phosphatidylserine, and L-theanine. So here is my night formula. So I have 7 capsules. Oh, that's a lot. Okay, so if that's a lot, let's do, you know what I'll do? I'll take the, where is that? Oh, we can do the whole here. There it is. Okay, so I'll take out with the hair formula. I can take out the amino acids from the evening. Let's say I want to take those out, so to kind of balance the amount of what I'm giving when, as well as the collagen. I can give that one in the morning, no problem. We'll keep those. There we go. Where we're at now. Okay, 5 capsules. That's great. That's what I want for her. I want 5 capsules in the evening with the detox support in the evening, with sleep support in the evening, and with a little bit of the hair support. And then the other thing that I will do now, I'll go into my AM formula. And I'll basically take out everything that I don't want, that I left in the night one, and I don't need it for the day. So, oh gosh, my computer is all over the place. Of course it is. There we go. So I'll take out the estrogen detox that I left at night. I do want the adrenal support for the morning. The antioxidant, I do want that for the morning. The hair one, so I'm going to basically remove everything but the amino acids that I left, that I'm going to leave here for the day. Basil as well. I'm going to leave the black pepper in for absorption. There we go. And then the ashwagandha I can take out here, as well as those comatives. Actually, I like GABA during the day a little bit, so I'm going to leave the GABA here because maybe she has a little bit of anxiousness or anxiety. Gave her some vitamin D at night. There we go. So now my day formula looks like adrenal support, antioxidant support, just the part of that hair support that I wanted to keep in the morning to kind of balance those out, and to balance the formulas out, and then my iron and some GABA to support some comatives for during the day. So I'll do calculate price, and that would drop it to 6 capsules. There we go. So I have now my AM and PM formulas for this patient, and I can do it even in the, that's the last thing that I did want to show you. So I can even show you here. So this is where I will add in the note section, is where I will add to tell her when to take what. So if this is my PM one, and I think this one I don't have the zinc with, so I will tell her to take this one in the morning. with no dairy, because I want all that iron to get absorbed. So this is where I would indicate those. And then with the PM formula, I will tell her to take it at night and take it with food, because I don't want the zinc to give her nausea before she goes to sleep. So that's kind of what I had for you guys today, and how I would utilize the Vitamin Lab portal and all those different things to strategize how I'm supporting my perimenopause women, and just generally my women patients. Do you guys have any questions? Thank you so much. This was amazing. Will we receive a copy of the recording? Yes. So we do have, we're going to upload that. It will live on YouTube forever. And then we will send you guys the link. Lastly, I am going to tell you that for everybody who joined me today, I really appreciate your time. And you will get a code for 15% off of your next formula. Thank you so much. Thank you for joining me. Any other questions before we hop off? Amazing. You guys have a good evening. Go eat something yummy. I appreciate your time. Thank you so much.